And honestly, once we graduated, they still had doubts. Like there were some that were still thinking like, oh, I want to go back to med school. I hear a lot that work-life balance is a benefit of being a PA. And I have to disagree a little bit. Hey everybody, welcome back to the PA Platform channel. I'm Savannah Perry. I'm a dermatology PA and the creator of the PA Platform. Today I wanted to do a little overview of what is a PA. What is a physician assistant or physician associate? We can talk about the name change, but PAs have been around since the 1960s and they have a long history, but it's still a pretty new profession. So we have a lot to go over. I'll talk about the schooling, how we got here, what my job looks like, what PAs can do, what they can't do. So you're a little more familiar with what the profession is. At the PA Platform for the past 10 years, I've been helping people figure out if they want to become PAs. And I just want to clarify that you'll never hear me say that one profession, including my own, is better than anything else. I think there's room for all of us in medicine. There are plenty of patients to go around, plenty of patients who need help, and that's what we're here to do. So I want to clarify that. If you've ever thought about working in healthcare but weren't sure what path to take, let me tell you a little bit about what PAs are, what we can do so that you can decide if it's a profession that you may want to explore. Make sure to subscribe to the channel and check out our other videos for more information on how to get into PA school and everything you need to do to be prepared to be an awesome PA. Traditionally, PAs have been ranked as one of the best jobs in the US. So from satisfaction ratings from PAs to the salary, training ratio of how long it takes. Overall, PAs usually rank in the top 5, if not the 1 or 2 spots. So that tells you a little bit right there about how awesome the job of being a PA is. And I think there's a lot more to it. So if we're talking about just the definition of what a PA is, PAs are medical professionals, healthcare professionals who work in medical settings in different specialties, who are able to see patients, take their histories, talk to them, examine them, come up with a diagnosis, come up with a plan. They can prescribe medicine, and that's one thing that differentiates PAs from some other professions. They can order labs, interpret those labs, order imaging such as x-rays, CTs, MRIs. They can do procedures such as excisions like me, and we'll talk about that a little bit more, but they can help with surgeries. They can be in the OR, they can suture, and really do a huge range of things. The interesting thing to me about the PA profession is even though we're all called PAs, our jobs can look so different depending on the area that we work in, geographically and the specialty. So being in dermatology as a PA, my job will look very different from an ER PA. And even ER PAs. I have friends who work in the ER, and between them, their jobs look so different with the acuity of patients they're seeing and with the types of patients they're taking care of, the things they're able to do, the things they're not able to do, the level of supervision. There can be so much variation. So to me, that's one of the benefits of the profession is because you can find a role and find a spot where your interests and your desires and your skills fit, whether that's wanting to do procedures or not wanting to do procedures, wanting to have more of a close relationship with a physician versus not having that close relationship. There's a lot of options there. So as PAs, we work with collaborating physicians, and that means that there is a doctor typically available to most PAs who they can refer to, whether that's for asking questions about a patient, whether that's seeing patients with them, working together in the OR. Again, it can look very, very different depending on that relationship, the level of experience, level of trust between a PA and a doctor. These agreements now expand into hospitals. So a lot of the states have gotten rid of the regulations that specifically tie a PA to a specific physician or provider and have made it so that PAs can work as part of a group or a team under whatever the specifications are of that hospital system. As a PA, when we get licensed, we have to kind of say what we're doing, at least in Georgia, and this can vary between states, but in Georgia, we have to say what we're doing, what our scope is. Our scope of practice means the type of patients you'll be seeing, the type of things you'll be taking care of, whether you're doing procedures, lasers, machines, all of these things. So if that changes, in the past, you would have to go through this whole process to get that new skill added to your license. But now with these broader arrangements and agreements, PAs are able to do a little bit more without as much red tape. So the thing that drew me to the PA profession when I was shadowing was seeing that collaboration between a PA and the physician and the nurses and everyone, and how they contributed to patient care firsthand. So I highly recommend, if you're on the fence or not sure or kind of want to understand a little bit more, getting some shadowing experience. By shadowing the doctor and the PA, I went with both of them separately and with them together to see patients, and I was able to see what their roles looked like and see what their relationships between everyone on the healthcare team looked like. In my mind, the most important person on a healthcare team is always going to be the patient, and seeing how they cared for those patients and the care and time that they put into them was something that really stood out to me. I think there are so many great healthcare providers out there, whether they're PAs, doctors, NPs, nurses, and together we can make patients have a better experience. And that's been my goal this whole time. So as far as becoming a PA, there is a pretty specific path that you take. You get an undergraduate degree, it doesn't matter what it's in, and then you have to complete your science prereqs. So that can be done during your major, or if you decide on PA later, that can be done after the fact. Typically, you're going to need patient care experience, some shadowing, some volunteering as part of your application process. When you apply to PA school, there are some standardized tests involved, but you'll do your 4 years of undergrad and then go into a PA program. These are pretty competitive, and complete a program that is anywhere from 24 to 36 months. So around 2 years that you're in school full time. And it's no joke, it is a full-time job. Most programs won't even let you work. Like mine, we were not allowed to work, and it would have been impossible because we were in class from 9 to 5 most days. We might have a half day off once a week. And after that first year of didactic, we then went into clinical rotations for a year. Mine were 4 weeks, and we were working whenever the office was open, whenever the provider we were with was working. So at the end of PA school, you take boards, which is called the PANTS, and you have to go in, take boards, and then get licensed in the state that you want to practice in. And then every 2 years as PAs, we have to do continuing education credits. So we have to have 100 of those every 2 years, which means going to conferences and reading journals. And then every 10 years, we do a research. So I just did my first one. It's called the PANRE, or the PANRE LA, where you take this test again to make sure that you're brushed up on all of your knowledge. Now, for me, being in dermatology, derm only makes up about 4% of that test. That makes it a little bit tough when it's everything we learned in PA school. One thing that's interesting is you don't have to specialize in PA school. You're taught kind of everything. You get an overview as a generalist, and then if you decide to go into a specialty, you would get more training on the job in that area. There are some postgraduate programs now. They're not like a full residency or fellowship like a medical student would go into, but they are 1 to 2 year programs in certain fields such as ICU, surgery, psych. There are some unofficial derm ones. The ER is another big one. Doing these fellowships and these 1 year post-grad programs can help get you that extra experience, and you do get paid for these. You may not get the higher range of what PAs make, but you do get paid during these training times. And I don't think I've ever talked to anyone who's regretted one. I personally didn't do that. I just trained on the job. That brings us to one of the cool things about being a PA is that you can switch specialties. So even though I work in dermatology, I've always worked in dermatology. If for some reason I were to move or need a new job, I feel confident that I could get that, and my experience in dermatology would be helpful. So if I went into a surgical specialty like plastics or general surgery, I have experience doing excisions and the things that I would need to do to transition into that. But if I needed to go into something like cardiology or endocrinology, it would be a big change. I would have to take some time to study and brush up on things, and I would have a lot of questions, but I feel confident that I could do that, and having that job security is very meaningful to me. Would it necessarily be my dream job if I had to switch? No, maybe not. But I feel like the jobs are out there, and every job you take as a PA is valuable to your education and just making you more well-rounded as a provider. So while there are a lot of benefits to the PA profession, there may be some downsides too. And if you are someone who feels like you have med school in the back of your mind and you're always going to be thinking about it, you may want to go that route, and that's fine. You've got to decide for you what fits best, not for your parents, not for your advisor, not for your teachers. What is going to be the best route for you? For me personally, I fell in love with the PA profession when I shadowed, and I never looked back. I never had doubts. But if you're having doubts, that's okay. Take more time, talk to more people, shadow more. You can visit our friends at Medical School HQ. They help on the pre-med side. Visit us at the PA platform. Keep watching to figure out everything you want to know about the PA profession. We have some virtual shadowing you can watch. We also have pre-PA counseling. If you just want to talk through it with somebody, we're happy to help. This is a big decision. Yes, as a PA, you could go back to med school. There's no really true bridge programs because you'd still have to make sure your classes are up to date, take the MCAT, and then go into med school and do a residency. So it's not really abridged if you decide to do that. I think back to some of my classmates that I know had doubts through the program about whether, was PA for me? Should I do med school? And honestly, once we graduated, they still had doubts. Like there were some that were still thinking like, oh, I want to go back to med school. And that's such a big chunk of time that you've devoted to this. So I think if you can decide and figure that out beforehand, that will be helpful. If you're thinking nursing or NP, I encourage you to kind of figure out how your state is, if it's more PA friendly, NP friendly, if that makes a difference. I'm in Georgia, they're essentially the same, but laws can always change too. So that's something to just ask about and look at the medical board, the medical licensing board, and they'll give you more information on that. So while PAs have a lot of flexibility to switch specialties, and I work part-time as a PA now, which is fantastic for me. I have that flexibility. My loans weren't as much as they were if I'd gone to med school, so I felt comfortable moving to part-time after 5 years. I hear a lot that work-life balance is a benefit of being a PA, and I have to disagree a little bit, because while I have a great work-life balance with being able to work 2 days a week, there are lots of PAs who work more than their physician counterparts. When I was at my old practice, I worked more than any of the doctors there. So just because you are a PA doesn't necessarily mean you'll have a better work-life balance. To me, no matter what your profession is, that is something that you choose and you prioritize. My husband, for instance, he's a doctor. He works 7 on, 7 off as a hospitalist. He thought about doing an ICU fellowship, but decided, I really want to be home with my family, and decided to stop at being a hospitalist. And he loves his job. He really does not pick up extra shifts because, again, he wants to be home. He could work every day if he wanted to and make a ton of money, but instead, he prioritizes being home as a doctor. So that is something that you have to decide. And, are you going to take extra call? Are you going to pick up shifts? Are you going to have multiple jobs? How does that weigh the money, the financial side versus your work-life balance, and how important is that to you? But just because you are a PA doesn't necessarily mean you're going to have a better work-life balance. So if you're thinking about going into PA, I really encourage you, again, just to shadow and talk to PAs. Make sure it's something you want to do. See how they interact with patients. Fall in love with the profession and what we do, and not just the perks, because there's a lot of options out there. There's a lot of jobs, but I think if you can figure out why PA is the best fit for you, that will make your application process smoother, your essays will be better, and you'll need to be able to explain this to patients, family members, and the admissions committees. So that's something to start thinking about if you are leaning towards PA. If you have any questions about the profession that I can answer, please let me know. So I've only ever worked in dermatology, and now I work part-time. So my day starts around 8 o'clock. I start seeing patients there in 10-minute slots. So derm moves very, very quickly. So I'm seeing around 35 to 40 patients a day, and I'm seeing acne, rosacea, psoriasis, eczema, molluscum, warts, skin checks, skin cancers, the whole gamut. I'm mostly medical, but I also do procedures like excisions of cysts and skin cancers, and some cosmetic derm. So some Botox, some filler, and some lasers. I love the variety. I see kids, I see adults. When I first started, I shadowed the doctor I was with for months, like 4 to 6 months. And then I slowly started seeing patients on my own, like easy stuff, follow-ups. And then we transitioned to seeing my own patients. And it took me a while to get comfortable. I was asking lots of questions. I was studying. I was going to conferences. Now, 10 years in, I'm much more comfortable. It's fairly rare that I bring the physician in with me. If I do it something super weird or something I feel like she'll have to follow up on, or sometimes, honestly, just something interesting that I think she'll enjoy seeing. If it's something kind of rare that we don't get to see a lot, and I want her to put eyes on it also. We talk about patients a lot. We talk about updates in just medicine and dermatology. And so we're always constantly learning from each other. We have a mutual respect, and I appreciate their willingness to teach me and help me learn to get me to that point where I feel comfortable. So I enjoy my job so much. I love it. I hope I never have to leave derm, but it's been a great experience so far. And I've been very blessed with amazing teachers and amazing support in the office space. I wouldn't necessarily go into PA school if you only want to do one specialty, because sometimes certain jobs can be hard to get. Derm is a little bit of a competitive one. Let me know if you want to hear about how I got my job in dermatology as a new grad. I love it. I wouldn't change anything about what I've done. All right, so if you are thinking about working in medicine, you want to help people, you're not really sure what you want to do, maybe PA would be for you. If you found this video helpful, make sure you subscribe and follow along for our other videos, and follow us on social media where we post all kinds of tips and helpful things.